To welcome you all. So my name is Sabina Suba. I'm an Assistant Director for Patient and Public Involvement Engagement at the Central Commissioning Facility at the NIHR. So I just want to say thank you so much for attending today's session and congratulations for making it to the next round of the interview process. Really delighted that you've stepped forward and joined the call to get involved in the NIHR. So before we start, I'll just do a quick round of introductions of who's on the session, who's joining me today, will be sort of leading the sessions. So I've got Heidi and Kat, if you want to give away, from the PPI team. And also we're delighted that we have Una and also Alera, who are experienced public committee members. Give a big wave. And they will be leading some sessions today around top tips that will hopefully help you during the next stage of your interview process. So just before we sort of kick off into the agenda and talk about the sort of key points that we'll go through today, I just want to go through some housekeeping. We are recording the session today, so I hope that's okay with everybody. If you don't want your video recorded, then or your face on the recording, then you can switch to audio. And the objective of doing that is that we can share the session with those colleagues who couldn't make the session today as well, to support them during the recruitment process as well. And we're also asking you please to mute your mics. And also in terms of the Q&A session, we're hoping to actually run that through the chat functions, only because we do have a lot of people on today. We only have an hour session, so I think we're best if we do it in chat as well. And if we can't address all the questions today, we'll do a Q&A post meeting as well, which we'll share with yourselves after the meeting. So I'm just going to share some slides with you just to go through the sort of key headlines and the agenda as well. So bear with me, please. So hopefully you should see the slide sets. So we're just going to kick off with a quick intro of the NIHR and public involvement in the organisation, realising that some of you are quite new to the NIHR, so hopefully some of these key headlines will give you a bit of context setting. And then I'll turn to Heidi to talk about the sort of recruitment process, what the next steps are. And then I'll hand over to Alero and Una to talk about the sort of top tips and research applications. As you know, we'll be asking you to review a research application as part of your assessment for the recruitment. So they'll give you some top tips on what to do in terms of that particular process, and we'll take some questions as well. And then we'll go on to top tips on good practice on committees as well. So hopefully this will help you in terms of your interview as well. So the good things to look out for when it comes to the committee as well. And we'll take questions again. And then we'll close the webinar hopefully just around 12 o'clock. And we'll take questions again if we haven't had time to cover them in the previous sessions as well. And just to let you know, I have to leave at 11:50 because I have another meeting, and my colleague Kat will take over the session. So in terms of public involvement and the NIHR, I just thought I'd just give some quick headlines that will hopefully help you in terms of setting the context. So some of you will know that the NIHR is the UK's largest funder of health and social care research. We were only established in 2006, and our basically mission and mandate is to improve the health and wealth of the nation through really good quality and excellent research. And we are funded by the UK Department of Health and Social Care. We have a really ambitious vision, and our vision is that we hope that a population will be actively involved in research to improve health and well-being for themselves and their family and neighbours. So essentially, that sort of vision is embedded throughout our whole ethos across the NIHR. The diagram on the right kind of shows the different stakeholders that we work with through the NIHR. Patients and the public and carers at the heart of decision making. We also work with researchers, and we support them to be able to do the best quality research in the UK. We also work with other funders and charities and industry as well to ensure that translation of our research really has maximum impact as well. And the research that we fund is essentially just one outcome, and that is to ensure that it benefits the NHS, the public health and social care as well. We also support deliver infrastructure for research as well. So that essentially is the buildings and the people to deliver and the workforce to deliver really high quality research as well. And in terms of sort of, public involvement and the different spectrums that actually occurs across the NIHR. So essentially, we're really committed to connecting people and communities to the research that we fund. And that essentially means that the patient and public voice should really be embedded across the whole of the research spectrum, so all the different stages. So on the right here is a diagram that identifies all the different stages for research, which is identifying and prioritizing the sort of research priorities, design of research, development of the proposals, actual delivery, and the monitoring as well. So all along those spaces, we ask all our award holders to ensure that people and communities are really sort of partners with researchers in delivering all those stages of the research cycle. And before we get to the cycle, there's also the commissioning of the research, which is the bits that you are, wanting to get involved in. And that's actually about, how we sort of select the research that we want to fund. And within that process, we also have patients with lived experience and communities involved, working with academics to be part of that decision making as well. And the whole reason we all do this is really simple. We do this in order to improve the research quality and the impact of our research that we fund across all the different sort of spectrums. And then just in closing, I just wanted to allude to the UK standards of public involvement. This is just some background information for yourselves. I know you've all been really involved and active in your communities or within patient groups as well. But within the NIHR, we have a values framing in terms of how we think about public involvement. And these 6 sort of like headlines are basically values that we aspire to in all that we do as well. So we do expect our researchers who we fund to be able to live out these values in all that they do. And they are basically your sort of basics when it comes to involving and engaging people meaningfully as well. So hopefully that's just some quick headlines. We'll share the presentation with you after the session as well. I'm going to hand over to Heidi now just to talk about the next steps in terms of the recruitment process as well. Heidi, over to you.
Hi, everyone. Sorry. So you all probably know me because I'm the one that's been sending you a whole load of emails with regards to the interview. So I'm just going to take you quickly through a tour of what the next steps are. Let me just share my screen. Okay. So basically, the next steps is the interviews. So all of the interviews will be taking place next week and the week after. The application information pack has already been sent out to those who are having their interviews next week. And the ones that will have their interviews in the first week of May, I will be sending out the information pack to them sometime this week. So your interview will take approximately 30 to 40 minutes. The program manager or the program committee chair will give you an overview of the committee and the work that is involved. We'll then ask you some questions around your interest, knowledge, and experience in patient and public involvement, and talk about what skills you can bring to the committee. We will then ask you to present your assessment activity. So those who have not yet received their information pack, the assessment activity is to review a research funding application, and we ask you to provide your views on the application regarding the PPI aspect of it. So Uno and Alera will give you some tips later on. Please don't worry about the interview. I know that some of you already reached out to me and saying how anxious you are. I know it's easily said than done, but we really do try to make the interview as informal as possible. It's an opportunity for you to get to know the work that we do, as well as for us to get to know you. Yeah. And also, if you need any support on the day of your interview, please let me know ASAP if you haven't already done so. With regards to the outcome, we normally aim to notify everyone of the outcome of the application between 1 to 2 weeks after the interview. Please be patient, because at the moment we're currently recruiting for 8 committees this year, and each committee has its own interview session. If you are appointed, your initial term will be 2 years, with an option to extend it for a further 2 years after a review. Now, as a public committee member, you're offered a fee for your work and participation in the committee. The fees will be dependent on the volume and the nature of activities required before, during, and after the meetings, and these are outlined in the payment guide, and the payment guide will be provided to you in your induction pack. We also reimburse all reasonable expenses associated with your involvement, such as your travel and overnight accommodation. So this will all happen eventually when we get back to normality, whenever that will be. With regards to the induction process, so we normally invite you to observe your first meeting rather than be an active member. This will give you the opportunity to meet other committee members and observe the committee at work before contributing to it. You'll also be given access to NIHR Learn, which is a virtual learning platform for our public committee members. In this platform, you'll be able to access a number of learning resources and guidance documents that will help you carry out your role effectively. The program manager will also arrange a convenient time to call you before attending your observational meeting. These calls will be an opportunity for you to focus on upcoming meetings, clarify any questions that you may have, and start to build a working relationship with the program team. We will also allocate a buddy to you. So the buddy system is to help you settle into your role. A buddy is another public member on the committee. They're there to provide some additional informal support, either by phone or email, before your first few meetings. And then there's obviously the administration side. So if you're not already registered on the RMS, we'll send you the link to register on the system. This is the system that we use to process all of the research funding applications and also the commissioning processes. And then we'll also ask you to complete a personal record form where we'll ask for details such as emergency contacts, dietary and accessibility requirements. And last but by no means least, I know how disappointing it can be if you're not offered the role. Can I say, please don't be disheartened, because we usually recruit on an annual basis. You've gotten this far already, and you will experience the interview process. So if you then don't get appointed this time round, please feel free to apply again in the next recruitment round if you're still interested. And that's it from me.
Thanks very much, Heidi. So we'll just move into the next session, and that's basically to give you some top tips on how to review NIHR research application. This, I understand, is one of the tasks that will be given to you in terms of the next stage of selection process. So hopefully these top tips will support you in this activity. So I'm going to call on Alero to share your experience as a public committee member who's been doing this for a number of years now, on sort of any top tips that you can share with colleagues on the call right now, and then I'll hand over to Uno afterwards. So Alera, over to you.
Hi everyone, congratulations getting this far. I did have to go for an interview myself, and I had the assessment. Yeah, so it's not daunting. So the things that I look at when I see an application, first of all, it could be so many pages, but I tend to go to the lay summary first. As if you go to the lay summary and you can understand it, the chances are you'll be able to understand the rest of the application. If you read the lay summary and you don't understand it, you may start having some difficulties. And the lay summary is what we do as the public and patients, our involvement, we help with that. So if the lay summary is clear, you know that the probability and outcome is that they had already got the public and patients to review it. The other thing I tend to look at is diversity. How diverse is this application, or subject to what it is? Have they involved more people, or is it going to cover a number of people? How diverse is it going to be? So that's something, again, that I tend to look for. I also tend to look for I look at the budget. Now, as public and the public and patients, what do we do? Are they going to train? You will look for training. What allocation have they set aside for it? And if there's provision there. So that's it's a key thing, but you don't have to put the figure yourself. You just want to see that they've considered it. The other thing I look for is the co-applicants. Have they invited anybody else to become a co-applicant in the process, in the application or this thing? Yeah, the co-applicants. When you go to the PPI review, you want to see how soon did they involve people in it. And one of the things that I would like to explain to you is like, Sabina has mentioned the research cycle. So it's from the beginning, have they identified, when did they get the public and patients involved in it? At what stage? What you don't want is just a bolt on, they just added it on to the, they've just added it on. You want to see how soon and how early. So those are the key things that those are my top tips when I look at an application form, because you could have a whole bundle, but look at what is in front of you. And also think, if you have the lived experience, is this something that you would want? Is this the way you want it communicated to you? But if it's not part of your lived experience and you have a carer, you would also want to read, is this how, your own opinion, is this how the public would want it? And again, I think another key tip is to be fair, reasonable, and objective when you are looking at the application forms. And if there's potential is quite important, because some people do not have the time, but if they can demonstrate that they have potential and you can read from the application that they would fulfill it, or it's a question you could ask afterwards, because you do have provision to actually put comments. The purpose of the application, or the purpose of us sitting there, is not to be critical, but to be constructively. We have to be constructive in our critique, because the whole point of research is to help everybody else. So, Una, is there anything you would like to add to that?
Yeah, I think I'd just add, there's no right or wrong answer in a lot of this. It's about your opinion, I think. It's remembering that what you think is a valid point of view. I talk to friends and peers about health issues a lot and read a lot of stuff online, and I often read, what people are commenting on social media. So I have a broad sort of grasp of what people who are not necessarily like me might be thinking about things. But at the end of the day, we're not representatives when we review applications, we're individuals. And so your point of view is really important. I'd also say you need to look at what's in front of you. When I've got an application in front of me, I don't go off Googling the subject. My opinion is that the applicant should be able to explain well enough in the plain English summary, the lay summary, what the basic principles about what this is about, what question are they asking, who's going to benefit from the research, and how are they going to do it. I should be able to get all of that from the plain language summary or plain English summary. I will go and look, that's my first, as with Alara, that's my first starting point. And then I'll go off and look at the section on what they're doing with patients and the public. And in many respects, I shouldn't have to go very many other places, because those two things should tell me what I need to do. I cross-check into the budget to see whether the budget reflects what they're saying they're going to do in PPI. And I will go and cross-check in the main part of the application and read a bit more there as well. But just remember, we're not expected to be experts in the science or the methods. We're there to comment on the importance of the topic and how public voices are included, and whether we think we would, or our family would, participate in the research. Those are the things we're looking at. I also think it's important to be succinct, to be brief, not just regurgitate the whole application in your review, and to focus on highlighting what's good about it, what's missing, and how they might improve it. And I often use the standards as a framework, looking for those sort of 6 key headlines that Sabina showed us, and seeing whether they're doing something in those areas. I'll stop there.
Yeah, I just want to add, I also add the research cycle for those who are aware of the research cycle as well, because you know at what stage, and if somebody explains why they've not been able to involve the public and patients, it gives you a clearer view. They should have some rationale or reasoning why they've not been able to do it. So if you have any questions for us.
Yeah, so thank you so much, Alara and Una. I think that was really useful, the headlines that you talked through. I just want to say before we go into questions that I realized that not everyone has seen a copy of an application yet. So I think some of you have interviews next week, so you would have seen what a NIHR research application looks like, the whole lot of it, lots of pages and sections to it. So I'm mindful that not everyone has seen a research application, but we will record the session and share this with you afterwards. So hopefully you can sort of tune into some of the things that Una and Alara just talked about right now as well. And I just wanted to add also that in the interview stage, you'll only have about 2 to 3 minutes to feedback your reflections on the application as well. So just to kind of to bear that in mind as well. So yeah, so this is over to yourselves now. So does anyone have any questions or comments or reflections about the research application task? Please feel free to ask in the chat function as well. We do have a bit of time, so if you do want to actually speak and actually ask your question, please unmute yourself. Just wave your hand and let me know if you'd want to speak, and I'll bring you in. Ah, Simon, I see Simon and Derek. So Simon, do you want to go first, and then we'll go to Derek?
Yeah, typically within a meeting, how many research grants would you look at, or how many proposals would you look at?
So Una and Alara, can I turn to you for this question?
Yeah, it can vary enormously is what I would say. I've been in past committees where we might have up to 30 to look at between two of us. I've been in other committees where I might have 4 to look at. So it very much depends on the committee, which is why there's this sliding scale of fees as well. So it can vary enormously. And also it depends whether you're looking at stage 1 applications, which are much shorter, or stage 2, where there's a lot more depth in them.
Thanks, Una. And Derek, can I go to you for your question?
Yeah, can I ask, do the committees tend to concentrate on a particular subject, or is it a vast range of subjects? I know Alara said that we're not expected to be experts in any of the subjects, but it just wondered if there's a tendency for things to be grouped together maybe, or how does it work? Obviously, I don't know.
Alara, Una, do you want to take this question? This question?
Yeah, happy to comment. The committees, I mean, the NIHR PPIE team might be able to talk about the committees a bit more, but there's certainly there's lots of different committees that have different types of applications that go to them, but you can still see. So I'm going to use an abbreviation here because I don't actually know what the right term is. HS&DR, Health Service and Delivery Research, I think it is, covers a broad range of topics in it. And the PRP committee, which is priority, I don't know what that's called. I can see.
Policy Research Program.
Thank you. I should know because that's the one I sit on now. Also has a broad range of topics. It's in the domain of policy research, but there's a broad range of topics. So sometimes, I mean, you can be reading about things. I mean, I do sometimes Google like what is that just to get my head around something, but I don't really Google things. But sometimes you might be facing, it's why you can't be an expert in everything. You're there to give a particular opinion. So you can face a lot of different topics in one space, generally speaking.
Do you want to come in there as well, Heidi? You got your hand raised?
Yeah, I just wanted to say, so basically for you're applying to the CCF program. So if we look at those that have applied for RFPV, Invention for Innovation, which is your I4I, and your program grants. Now, in each commissioning process, you will be looking at a broad range of health topics in these applications. Una, you can correct me here. For the policy research program, what tends to happen with this one is that the Department of Health will put out a specific call for a specific area related to policy. So, which means that you will get a number of applications from research applicants who will submit their research based on that brief. So, yeah, but all of this, will be explained to you at your interview. The committee chair will explain to you what the work that they do, and so will the program manager will also explain to you the number of applications, the average number of applications that tend to come in, and how many will usually be allocated to you. So
thanks, Heidi. Alara, did you want to come in just quickly as well? I think you were saying something.
No, that's all right.
Okay, thanks. So before we just go to Terry, Amy, and Simon, I think Ed, you messaged me as well. Did you have a quick question to ask as well?
Well, I did have a question. Yes, I did have a comment. It's a question really. Obviously, the patient perspective is one aspect of considering an application for funding, but there's obviously other perspectives. There's the medical perspective. It might be a community social care perspective from practitioners or providers or commissioners of services. So I was wondering if a patient or a patient public member is reviewing an application, they may think it's worthy of consideration, or they may think it's not a high priority for them in terms of what they understand to be a patient need, in terms of what they see on social media, or newspapers, or what people are thinking about in terms of what needs urgent investigation. So I was just thinking of the mechanics. If a patient perspective is different from the other people who are reviewing the same application, how is that sorted out, and how is that discussed, and at what stage is that discussed? And I mean, I was interested in the mechanics really. Once you've read it, how is it discussed with other parties or stakeholders in that process? And how do you arrive at consensus or agreement as to what to fund or what to take forward or not to take forward?
Sure, thank you, Ed. That's a really important question. And I think I might turn to Alero on this about reaching consensus on the committee. If you could just give an answer on that, a comment, that'd be great. Thank you.
Yeah, so the reason why more than one person reviews an application. So we have peers who review the applications. So what we do, I mean, as for us, we're the PPI representatives. Then you have other experts who will review sections. So whilst you've gone through the whole application, you just comment on the PPI aspect. They will comment on the medical or whatever aspect, but they're given a particular area of expertise. And you'll sit down at the committee, you score it. You'll sit down at the committee and you agree. So it doesn't matter if you feel that it's worthy or not worthy. When you sit down in the committee, it's all going to be discussed, and people will say the merits and demerits of each application. So there's a fair process about it. Does that answer your question?
Yes, I've been asked this question before, so I'm going to pose it here. If people disagree, how is that taken into account?
It's not, they don't disagree. You don't disagree. You have a scoring system.
Right, okay.
So it's measured. So you have a scoring system. So if you give it a 2, somebody might give it an 8. So on average, whether it's going to be suitable for funding or not, but you also have to give reasons why you disagree or don't disagree. But you all don't have to agree on everything.
All right.
Thanks, Lero. And we'll pick up some of these questions and elaborate more actually on a Q&A. Some of the things that I'm getting in chat, I think we need to talk a bit about the committee process as well, so we can do that as well. So we've got about a couple of minutes. I'm just going to go to Simon, Amy, and then Terry with your questions or comments as well. Please, if you could keep them succinct, that'd be fantastic. Simon?
Good morning. Yeah, it's following up on Stella's question about the interviews. You said that we'd have 2 to 3 minutes on a question to answer. Looking at the funding application, there's 4 separate headings. Do you have 2 to 3 minutes on each one of the headings, or just on the whole application?
Thank you. I'm going to turn to Heidi on this question. Do you want to give a comment?
So Simon, you have about, let's say, maximum of 3 minutes. Sometimes we can extend to 5, depending how far we go. But to summarize your full views of the application, so that's covering all those different headings. You know, what you thought was the strength, the weaknesses, improvement. So yeah, because this is basically what it would be like in an actual committee meeting. That's the time that's allocated to you to give you a full summary.
And I think it's going back to what Una and Ella was talking about earlier about, you know, diversity, the lay summary and the budgeting as well, and whether or not PPI is meaningful across the whole spectrum of the application as well. Amy, can I turn to you for your comment or question, please? I think you might be on mute.
Is that better?
Yep, I think so. Yeah.
Sorry, my headphones. Apologies.
No worries.
Just to thank you for the opportunity for this conversation. It's really, really helpful. And Alero and Una, you know, really useful comments. My question is, we were asked to apply for one particular committee rather than to be considered in the round. I'm just wondering if we're unsuccessful in one committee, could it be that we're opportunities might come up in another one in this recruitment cycle?
Heidi, do you want to answer this question?
Hi, Amy. Sorry, no, because currently, so what's happened is now is we're all going through, all the committees are all now going through the process of interviewing. So, and hopefully within the interviews, they would have already appointed the required number of public members that they need. So, like, if you are unsuccessful in this round, what I would suggest, and if you're still interested, is, you know, keep an eye out for future opportunities, because we do tend to recruit every year. So, you know, your advantage is that you've already gone through the interview process, so you'll know what it's like. Yeah, and then apply again next time.
Thanks, Heidi. And Terry, do you want to go next?
Yes, thank you. My comment question really is relating to the actual review meetings when you would get together. Is the intention to have these always as a physical meeting? Because I can appreciate why you would need that. Or will there be an element where people may be able to Zoom in? Because I've noticed from other areas it's becoming much more prevalent to do almost a 50-50 split. It saves costs as well. That's it. Thank you.
Thanks, Terry. Heidi or Kat, do you want to pitch in with this question? Kat?
Yeah. Yes, I think, Terry, the program teams are looking into this at the moment. For now, all committee meetings are virtual, and I think we can safely assume that for the rest of this year, they're probably going to be virtual. And then, you know, depending on how the situation improves or changes, will be changes as well, but it might be that that these meetings we run as almost like a hybrid meeting. So, you know, with some people present in person and some joining virtually.
Thanks, Kat. So before we go on to the next session to look at sort of the top tips on the committee meeting itself, I just want to address some of the comments that come up in chat. So, Sarifa, thanks for your question. Definitely, I think if you need regional adjustments and you need extra time, then this is something the NIHR will have to do to support you in your on your actual role as well. So we can definitely do that as well. Any other additional support as well? And there's a question here around from Justin. Assuming you are on a committee and say you're reviewing 8 reviews, what sort of notice would you get to look at the 8 documents? Kat, I might turn to you as the guru in this area for any sort of feedback on this, please.
You probably have 2 or 3 weeks to look at these applications, but Alero and Una may have a more up-to-date information on this. So please shake your head either way if that's.
I think it depends. Like the COVID rapid review, we're given like 48 hours to review, and it because of the situation. So otherwise you're given at least 2 to 3 weeks. But it's up to you. I think one of the key things is for you to be able to understand how do you read, how fast, and what time you allocate to it. So whilst we've concentrated on the PPI section, it's always good to have a global overview of the application form itself. Don't just go directly to the PPI elements of it. You should give yourself time to be able to read the whole application and then zoom into the areas where you want to critique. So we're given adequate time. And if you can't do it, you're also given time to say you can't do it.
Thank you, Alero. I think it would be great to have just one cheeky question or comment from Brian. Is that right? You've got your hand up, your virtual hand up. Would you like to ask your question as well, please?
Apologies, I'm using my son's iPad.
Oh, okay.
It's Justina.
Okay, nice to meet you.
Nice to meet you. Thank you so much. Do we get provided with IT equipment, or do we just use ours in terms of carrying out the reviews remotely?
Sure. So unfortunately, at current stage, NIHR doesn't provide any sort of hardware in terms of that particular support. The only type of support we do provide is sort of for reimburse you for any copies that you might make from applications as well, and obviously travel expenses, as Heidi has mentioned.
Okay, thank you.
Brilliant. So conscious of the time, and it would be great to have a good discussion around the next session as well. So the next topic item is around the committee meeting itself, and we'll probably actually address some of the questions that have been asked again in a bit more detail again, which is fantastic. So I'll turn to Uno on this in terms of top tips on the committee itself, and also just bear in mind that any tips for the interview as well that's coming up. If you can share any tips there, that'd be great, having been through the process yourself as well. Thanks, Una.
Okay, I just want to start with, committees can be quite big, but everyone is there because of their expertise, and that includes us as public contributors. We're there because we bring a unique perspective and it's a valued perspective. So it's just about bearing that in mind within a committee setting. So the committees are really about shared decision making. It's about listening to each other and learning from each other. It's about bringing together all the knowledge in the room to come to a shared decision. And it's not just about one part of the project. So what somebody was asking earlier about, as a public contributor, you may have a different perspective to the medical people in the room or the methodologists. It's about bringing all that together so we can all hear that. And it's also about understanding what's fixable within an application and what isn't fixable. So those are important things to remember. And I think the other thing that's important to remember is you may not have sat on a committee like this before, but we all have transferable skills. And I think we all need to step back sometimes and think about what other group meetings we've been in. So for example, you might have been to a support group, either as a facilitator or as somebody needing support, or you've been to a GP or care planning meeting for yourself or someone else to discuss a care plan. It might be a work meeting or a meeting advocating for someone else, whether it's your child or you or someone you care for. You might have been on a committee for a charity, part of a planning an event or a family meeting. So it's just about thinking about what situations you've been in where there's been a group discussion and sort of trying to address a particular issue. So key skills are things like listening, hopefully respectfully, being prepared when you get to the meeting, really important that you're prepared for the meeting. I often, with committee meetings, if they start before in the days when we used to go places, if they started before sort of 10:30 or 11, I would always ask to stay overnight, so I felt prepared rather than rush them morning, because I'm a carer, and trying to get out in the morning and do all the caring things that are expected of me if I'm in the house were always a challenge. I'd turn up stressed and tired and fed up before the day starts, so I would always stay overnight for those reasons. And it's important to know what your needs are around this sort of thing. Trying to be and stay calm and clear. Sometimes it can be frustrating when you're not understood, but it's important to keep calm and clear in those situations. And alongside that, not being afraid to hold your ground. You need to do it politely, but sometimes you need to hold your ground in terms of what you think. And And the other thing, it's really important to remember, it's okay to change your mind about your view of an application once you've heard what everyone else has got to say. So when it's your chance to contribute, so I guess this is the bit that applies to the interview to some extent, not just the public contributor, but also what will happen in a committee meeting. Usually, in my experience, Alero can tell us if it's different in the ones she's been in, is there's usually 2 or 3 lead assessors on an application, and then a public contributor as well. And the lead assessor will talk about the application in detail. The second or third people will contribute what they think, and then the public contributor gets invited to speak about what their views are. So there will be a public contributor allocated to every application form, and you really do have somewhere between sort of 2 and 5 minutes depending on which person you are in that group. So as a public contributor, you usually get 2 or 3 minutes to put across your general view and specific points about the application. So it's really important to be clear and be succinct and get the key points across. And you don't have to say everything. Often you're submitting written comments as well. You don't have, if somebody's gone before you said something, you don't have to repeat it. You might say, I agree with what so-and-so has said or whatever. You don't have to repeat it all. And I think generally there's sort of 2 to 3 key points per application, I would say, is what you're going to talk about. And sometimes, if they've done a really bad job of PPI, all you really need to say is they haven't done it. They haven't got anything in there. Or if they've done an excellent job, say that they've done a really fantastic job. They've done everything I would expect. Try and focus on something good about the application if you can. What makes it stand out? What's good about it? If there are weaknesses, is there a key weakness in there? Talk about what that might be. And talk about what you think might be improved. So it might be that all they've got is a co-applicant, which is great. So say it's great they've got a co-applicant, but it's one person throughout the whole study. It might benefit from having an advisory group of the patient group, or it might benefit from having a focus group to help to produce patient-facing materials or something like that. So you can start to sort of explore what else they might do alongside it. The other thing I'd say, alluding to what was being said earlier about Alero saying about how many applications you get and when you get them, most of the time what you'll know in advance is the date of the meeting, when you need to have your reviews submitted, if you have to submit them pre the meeting, and when you're likely to get them. And what I do is mark in my diary those dates so that I know that for me, that's the way I manage it. I forward plan and say, in this week or that week, I need to be able to have time to review 12 applications or whatever it is, and work out how much time how I need to do that, whether I want to do it all in one day or whether I want to do one a day. You'll often find in my diary application 1, application 2, application 3 spread out over a 2-week period, so I'm not completely bombarded by it. And finally, what I'd say in a committee, it's okay to have a different opinion to other people. And as long as you feel justified in the score that you give, because what will happen at the end is essentially in most committees now, you use some kind of electronic, often scoring system where you submit a score of between 1 and 6 or 1 and 8 or whatever it is, and the scoring grids tell you what each of those means, and it's for you to score where you think, and they then aggregate that to get an average score. And sometimes they will discuss if there are great disparities between the lowest and the highest scores. They will then look at those in more detail because there's obviously something going on there. But I'll stop there and let Alero pick up on anything that I might have missed.
Okay, thank you, Una. I totally agree with everything you've said. But one of the things that I would like to add is that try to be present. When I say present, that is be present and listen to everybody. So your listening skills and yeah, and hold your ground as well. I say that because I've been in committees where the researchers or the other peers will want to talk about PPI. But what you have to understand is that you're there as the PPI expert, so don't let them take that away from you. And even if they said something and you have, or you can agree with what they've said, but then go back to what you want to say. But I think being present is very, very important. And Una has said, be prepared. One of the things that I also find a lot of people, or most of them they have a lot of letters, they're doctors, they're professors, don't be intimidated by the titles, because they're all there to achieve the same objective. And don't be intimidated again about the way you speak, because we all have different accents. So it's just a case of just being yourself and enjoying the day, because you learn a lot from everything. And just be yourself, just be present. I think being present is the key for me, and being prepared. So that's all I have to add to that.
So much, Ella and Una. I think what I just wanted to add is, just going back to my presentation, is that patients and communities are really at the heart of everything that we do. So, you know, having your lived experience and your understanding of communities and patient groups is a real value add on the committees. And I think that's the overarching sort of, you know, driver for your role in those committees. And the NIHR is really firmly behind that ethos as well. So we have a bit of time, so happy to take questions. I think if you want to ask your question, please do so. Just raise your hand and we can come to you, or if you prefer to use a chat function, please do that as well. So any questions, reflections or comments, please? Oh, Heidi, did you want to come in?
No, it's just that Justin, you had a question in the chat about who you can reach out to in case of for any clarification and query. So depending on who your committee is, the program, you will have a single point of contact within the program team, a program manager, who you can always reach out to with any queries you have. But also us here in the PPIE team, you know, we're also here to assist you with any questions or support that you need.
Thank you, Heidi. And just to add to that, we do also have support and learning sessions. So in a normal sort of time, we would actually have face-to-face workshops with our public committee members, our chairs, and also our program team. And there would actually be sort of face-to-face sessions where we would sort of, you know, have a networking opportunity and provide some learning and support as well. Obviously, with the pandemic, we've kind of put everything virtually now. So there is actually an online resource that you can access as well in terms of learning and support. And we do sort of virtual meetings as well. So I'm going to go to, I think, Terry, you raised your hand first. Do you want to ask your question?
Yeah, very, very quick question then. Are all the meetings held at a central location, or do you actually move around the country at all with them?
Heidi, do you want to take this question?
Yeah, so for the research for patient benefit, if you're applying for that program, they're all regional. They're normally held, the committee meetings are normally held within that region. For your program grants, the Invention for Innovation and the Policy Research Program, the committee meetings for those are held at our offices in Twickenham. On the other occasion, they may, depend because of meeting rooms availability, they may sometimes hold them centrally in London.
Thank you, Heidi. Derek and then Abby, please.
Yeah, just picking up on something that Alero said, that I'm very aware that we are dealing with professors, doctors, researchers in this, who not only have a strong opinion, their actual livelihood is dependent on getting these grants. What is the mechanism? I don't want to be negative, but what is the mechanism that's in place to actually defend us in a way against some of these people? Because they can be very aggressive. And I just want to know what happens if we run into this situation where somebody gets overly aggressive, you know, almost attacking rather than defending their point.
Thank you. So I'll go to Alero and Una.
I'm smiling. I'm smiling because it doesn't happen. The reason why I say it doesn't happen is because they need the funding from the NIHR. And the overarching principle of the NIHR is to get the public and patients involved. So they do listen to our voice. And that is why we're there. We're the voice. So they can't get aggressive with you, or, you know, it maybe the tone or the way they say it, because they're well informed, or it's their baby, you know, and all that. But at the same time, what is the benefit of them giving us something that we don't want? So they all stand to correction. They're actually lovely people, to be fair, just passionate about their thing. So don't worry about that. And you have a voice. So you have your voice as well and your opinion. That's all that it is. I'm smiling because it doesn't happen.
I would echo that. It doesn't, or certainly rarely happens. I have certainly been in a committee where my opinion has been at the opposite end to other people in the room, and that can be challenging, which is why I say it's important to hold your ground and make your points clearly, and don't be put off by the fact that there's a professor here and a professor there who might be disagreeing with you. It's important to do that, but actually everybody who's there wants to fund the best research to get the best outcomes, and that's, you know, and they're in the interest of that, everybody's prepared to listen to all the points of view. So it's I've certainly never felt particularly attacked or anything as a public contributor.
And, you know, just to add to that point, because we've talked about it, as public contributors as well, it does not mean we have to have the same opinion either. So we could beg to differ. I thought I'll just add that.
And just to add the policy perspective as well, NIHR, all funding is predicated on the notion that, you know, public involvement will be sort of spread throughout the whole spectrum of the research as well. So it's actually a criteria of funding as well. And applicants and award holders, if they're successful, will be monitored against their PPI plans, which yourselves will be reviewing in the applications as well. So Abby, can I turn to you for your question or comment, please?
Very quick one. I'm sorry, there's a big lorry outside, so sorry for the background noise, because there's loads of noise and they're delivering something. If you've covered this, I'm really sorry if I missed it. How many of us are you appointing to each committee? Is there just one PPI person, or do you have more than that?
So it will depend. It will depend per committee. For examples, there are some where we're recruiting 3. There are some where we're only recruiting 1. It's basically the vacancies are all dependent on current public committee members' tenures, because you can only sit on a committee for a maximum of 4 years, and we're recruiting because their tenures are already coming to an end. So it all varies.
On average, it's about 3. Is it 3 public committee members for each committee? Is that right?
It's difficult to say, but I mean, we can definitely clarify to you at the interview, you know, how many we're actually looking for.
But on the whole, on the committee, there are usually 2 or 3 public committee members at all times.
So you won't be on your own. Brilliant. And so does anyone else have any questions or comments?
I think Simon and
okay, sorry, I can't see everybody at the same time, so I need to sort of move my screen around. So I think, is it Simon, you're next, is that right? Do you want to ask your question? And then we'll go to Graham. Simon?
Yeah, just remembering to unmute myself. It's kind of the opposite question to the one that Derek asked, actually. I've been involved in the charity sector a little bit, and I've been very heavily involved in PPI over the years. I have been a co-applicant for research projects, and as a consequence of that, I know a lot of the research people and the professors and the doctors at Bristol University and other universities, and I've been involved in their work in the past. How do you manage the possibility that there could be a conflict of interest there when you know, when you smile and wave politely at the researcher because you've known her for 10 years?
Uno and Alera, did you want to pitch in here, because you've actually been in real time in those sessions?
like everyone else in the committee, you declare interest, whether you've got a conflict of interest. So I've on occasion declared a conflict of interest because I happen to know the PPI co-applicant, or I'm working with a researcher in the application on something else. So we do the same as everyone else. We declare whether we have conflict.
And in that instance, would you just discuss your relationship with that person, and then the committee might decide that there isn't a conflict of interest?
There's usually different levels of types of conflict, and some of them mean that you leave the room for that discussion. Some of them mean that you stay in the room, but you don't contribute to the conversation, and other things it's just noted, and I think departmental conflicts and things like that.
Right, I understand. So this is something that does occur, and that there's processes in place to look after it.
Definitely.
That's perfect. That's answered my question. Thank you.
Thanks, everyone. So in the meantime, Sabina sent her apologies because she has another meeting that she needs to go to. So I'm taking it over for the last 5 minutes. And I think we've got Graham and then Ed with a question.
Hi, Graham here. I'm a member of a regional design service pre-submission committee, and it sounds from what Una said, I've emailed it, it sounds like a similar process where you get 2 people lead and then you give your views. My concern is that going on the sort of conflict of interest, if for argument's sake, if I was successful and become a member of the funding committee that I've applied for, and I then see that I've already reviewed this in an RDS meeting, is this a conflict of interest? Or will I have to do, like was being said, withdraw from that one application comment? Or do you not see a conflict of interest?
I don't know, Graham, is the honest answer. It probably depends on the region, the application, and we will probably need to check this with the program team. But, it's unlikely. And then, you will be, if it's a conflict of interest, then you will be allocated a different set of applications to look at. So there's enough applications for everyone to look at. I can assure you about that.
Yeah, I'm concerned that I'll be sitting on a funding committee on an application I've already looked at and commented on at the RDS meeting. That's all.
Okay.
Yep.
Thank you for raising it. We can cross this bridge when we get there and check with the program teams if they consider this as a conflict.
Yeah. Okay.
Thank you. Ed.
All right. Thanks. Yeah, I was just thinking about the fact that when I do an NIHR research application review, it's usually based on something I've had lived experience of. So often when they go out for public members to do a review, you ask, have you got experience with this particular condition? And so if there are 8 of these being considered in a committee meeting, I suspect that I won't have lived experience in more than about 2 or 3 of them. So if a professor or an academic could look at my comments and say, well, you don't have experience of that condition. So, I may feel not confident that my submission or my succinctness in terms of what I think of that application. If they don't have lived experience, I might well feel slightly more unsure or uncertain of my ground. So I'm just wondering, is it possible? Is it likely that, say, if I'm looking at 8 applications, I probably don't have lived experience in more than about 1 or 2 of them?
Absolutely, Ed. But I'd like to turn to Una and Dalero to answer this question.
Yeah, I mean, I've reviewed applications for things I've barely even ever heard of. But as a committee member on the committee, your expertise is in PPI and how patients and public are being involved in the process. That's your area of expertise. It's a bonus, I think, when you happen to have lived experience of the condition or the subject matter as well. I mean, sometimes you're reviewing applications that are to do with the way systems run in some of the the committees, so you're not necessarily going to have experience of those things. So yes, you will, and that's okay, because you can't have somebody with lived experience of everything, and it's often why there are public reviewers who are reviewing beforehand. So I've maybe looked at mental health applications that I might not have personal experience of, but the public reviewers have brought that perspective to it, and then my role is to look at what they've said in relation to it. So yes, you will. Don't worry about it. Your expertise is around the way that public have been involved in the process so far.
Thanks, Una. That's helpful. Thanks.
Thank you. Sorry, I'm just going to have to close this for now, because we've come to the end of the session, but just quickly wanted to answer to Liz's question. She was asking about if you are, as a public committee member, assessing the level of public involvement in a project, or also any ethical issues from a lay perspective, or whether the project will be clear to lay participants. I think yes to all of that, Liz. So you have a dedicated PPI section in the application form, but you are very welcome to look at the whole application and also pick up on any other issues that you, as either a patient, a carer, or just public, would pick out from such an application. And then just to say lastly that good luck to all of you at the interview. At the interview, Heidi has probably explained it in her last email, that you will have the opportunity to meet the chair and the program manager, who will be your contact in that program you applied for. And I believe there's going to be another current or former public committee member, and either Heidi or myself or Sabina will also be sitting on these interview panels. So, hopefully at least you will have met a couple of us by the time the interview comes. So please don't feel threatened by it. We are all there to support you at the interview, and I'm sure you will all be fantastic. If you have any questions, please email us or to Heidi, and we'll get back to you. And I think that's it for this session today. Thank you so much, Una and Alero, for sharing your tips. And thank you, all of you, for joining us for this session. As I said, good luck to you at the interview. Bye, everyone.
Enjoy it.
Thank you.
Bye-bye.
Bye.
Thank you. Bye-bye, everyone. Thank you.
Bye.